Adult head injuries aren't necessarily serious. Symptoms can include recurring headaches, nausea and vomiting, and difficulty in waking up. These symptoms may occur right after the injury, but also can appear up to 10 days afterwards. There are many types of head injuries. Some are less serious, and they're like shaking the brain slightly. A more serious kind is when the brain is actually bruised. That means that there's bleeding inside of the brain, which then causes it to swell. The bone surrounding the brain pushes against the swelling, and there's bleeding underneath. One common cause of head injury is from being involved in a car accident. If you aren't wearing a seatbelt, your head may hit the dashboard or the headrest. Injuries also occur from being thrown from a bicycle or motorcycle and hitting your head on the ground. People who play sports like football may get a head injury from being tackled and hitting their heads on the ground. If you slip on ice, you might hit your head when you fall. These are just a few examples of how a head injury might occur. A diagnosis is what the doctor decides which medical problem you have after examining you thoroughly. The doctor will ask you questions about your previous medical history in detail to help understand what is going on with you now. You will be asked about chronic illnesses, ongoing problems, previous surgeries, so the doctor has an idea of your health. The doctor may decide to get you something called an MRI, where you lie in a special machine that takes pictures of your brain. When you come out, the images are on a screen and the doctor can see if there's an injury. Remember, I said before that head injuries aren't serious? It's because they can be resolved. Sometimes an acute injury will go away very soon. Sometimes it takes a few days. Sometimes it takes a few months. It really depends on the individual. Always have somebody with you for up to a day after the injury to make sure you're all right. One way you can start to recover is to get a lot of rest and limit your activities. This includes exercise. Just don't do it. Just rest. Reading, thinking deeply, being on the computer, your brain needs to be turned off for a while. For 48 hours after your head injury, you should not drink alcohol. The over-the-counter medicines that you can use are Tylenol and Advil. These will help with your symptoms. One important way to avoid head injuries is to use a seatbelt every time you get into a car. Always wear a helmet when riding a bicycle or a motorcycle. If you play sports like football, wear a helmet. These suggestions will lessen your chances of incurring a head injury. You may be impatient and want to get back to your life. First, you must take 1 week off from all of your usual activities. Here's a symptom checklist to see if you're ready. If you haven't had any headaches, if you're not experiencing any dizziness, if you're not distracted easily and can concentrate, if you're not experiencing any confusion, if you're not having problems with memory and learning tasks, if you're not having any nausea or episodes of vomiting, if you're not experiencing unusual fatigue, if you're not feeling unusually irritable for no reason at all, if lights don't seem too bright and they're not bothering you, if you're not feeling unusually nervous or depressed, if your sleep is not interrupted by restlessness. If the answer to all of these is no, then you can safely resume your normal activities. Reasons you may have to return to the ER after your head injury include if you're feeling worse, if you start to feel confusion, if you're often groggy, fall asleep, and it's hard for others to wake you up, if you have sudden bouts of vomiting, if you're off balance and are having trouble walking, if the Tylenol or Advil you were taking for headaches no longer work, and even worse throbbing headaches return, if your arms and legs feel funny, as if they're rubbery, if your nose or your ears start to leak fluid, if your vision becomes blurry. This is a good checklist of symptoms. Remember, you're supposed to have someone monitoring you during your recovery. If you experience a seizure when you fall on the ground and convulse, black out, and you cannot be roused by the person watching you, it's important that they call 911 for an ambulance immediately.